Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuhu. Good day everyone. We are the group 6 and we will be discussing assessment and evaluation under perspective on teaching and learning. So earlier, group 5 has discussed planning and conducting classes. So after you have planned and conduct your class or during you are conducting your class, you are going to assess and evaluate your health teaching. Before we start with our discussion, my name is Jinan A.H. Taib and these are my group mates, Siti Rayana, Reham, Arafat, and Muhammad Saim. And our objectives for this discussion are: at the end of the lesson, we will be learning how to conduct learning assessment of clients. We will be able to enumerate the methods of evaluation as well as to enumerate the qualities of good measurement and have a knowledge on interaction process analysis or process recording. So we will start with the learning assessment of clients. So in this assessment, we will be assessing the client's learning needs, learning style, and readiness to learn. So this assessment includes finding out what the client already know, what they want and need to learn, what they are capable of learning, and what would be the best way to teach them. So you can do your assessment either by interviews. You can also consider using checklists and questionnaires to obtain information about the learning needs, learning style, and learning readiness of your client. So you can start your assessment by asking the client or interviewing the client about his learning needs. So you can ask questions like, what are you most concerned about? What are your goals for learning how to take care of yourself? And other questions that might lead you to know the learning needs of your client. And then you can also find out what the patient's learning style is, so you can match your teaching strategies as closely as possible to the client's preferred learning style. So you can ask questions like, what time of the day do you learn best, so that you can conduct your health teaching to that time the client learns best. You can ask questions like, do you like reading? Do you like watching videos? So that, or other questions that you might ask to determine the patient's learning style. So in summary, determining learning style involves assessing how the patient learns best, when they learn best, and how they are able to learn what they need to know. You can also find out whether the patient learns best by hearing, reading, or hands-on learning. And then you can gather information about the patient's readiness to learn, such as asking questions like, what changes would you like to work on now? How do you feel about making the changes we've discussed? Or other questions that might lead you to know the patient's readiness to learn. So in summary, learning assessment of clients is like seeing through the client's eyes. So this is a patient-centered assessment. You are going to assess the client's learning needs, what information or skills does they need to learn or improve, what are the client's motivation to learn, the client's ability to learn, the client's environment, the teaching environment, the resources for learning. So you can conduct your assessment by interviews, questionnaires, checklists, and others.
Assalamualaikum warahmatullahi ta'ala wabarakatuh. I am Rahama Kabantog. So, methods of evaluation. Evaluation is the systematic collection, analysis, and reporting of information about health education activities. Evaluating means finding out how well you are doing in your health education work in your community and making a judgment about your achievements. It is a critical assessment of the good and bad points of your health education interventions and how they could be improved. Evaluation is the process of assessing whether your specified objectives have been achieved. In other words, how successful you have been. There are three types of evaluation. First is process evaluation. and impact evaluation and outcome evaluation. So process evaluation is concerned with assessing the process of your health education implementation and how the work takes place. It can be carried out throughout your activities and can guide you to make changes to maximize your effectiveness and efficiency. In process evaluation, you evaluate the progress of work performance, whether the planned activities are carried out efficiently, cost-effectively, and as scheduled. Process evaluation is conducted while health education activities are going on. Methods on how to conduct process evaluation are gather feedback from those people who received health education, for example, households, individuals, community key informants, and etc. Use information gathered from interviewing them and through discussions. Observe while the health education session is being conducted, and then next is use a checklist to see whether health education activities are conducted as planned. And the impact evaluation and outcome evaluation will be discussed by the next reporter.
Assalamualaikum warahmatullahi wabarakatuh. I am Arafat, I am Haji Hamid, and for this video, I will be continuing discussing about the other two methods of evaluation. So my group mate already discussed about process evaluation. So in this video, we will be discussing about the impact evaluation and outcome evaluation. So let us start by discussing about the impact evaluation. So what is impact evaluation in health education? So before that, let us define what is impact. So when we say impact, it is an immediate effect or change produced by an intervention. So usually the impact refers to the changes that you have observed through after conducting your intervention. So usually in health education, these immediate changes may include changes in awareness, knowledge, attitudes, beliefs, skills, or any health-related behavior. So in health education, we define impact as an immediate changes, such as if they have any change in their behaviors, if they have any changes in attitudes or beliefs, or somehow how they take care of their health. So that's how impact being defined in health education. So proceeding to the impact evaluation is that impact evaluation refers to assessing the immediate effects of your health education activities on the people who have received health education messages. So this type of evaluation is usually carried out at the end of your health education activities. So yung impact evaluation generally, its main purpose is to assess the immediate effects of your health education activities. So in impact evaluation, we're trying to assess how does your interventions, medical interventions, or any health interventions have brought changes or impact on the behavior, the attitude, or how people take care of their health. So we're going to do impact evaluation to observe how people behave after receiving health education messages. However, if no improvement has taken place, then something is probably wrong with your intervention. So either with your messages or your method. So when you don't see any improvement in the people, so it may be there is wrong with your interventions or your messages in delivering health teaching or health education. So there are means how to conduct process evaluation. I mean, there are processes how to conduct this impact evaluation. So in impact evaluation, we should one way is to conduct interviews, to have focus group discussions and observation methods to check whether first is behavior has taken place. Number two, the level of knowledge has been improved, and the third one is the desire to has been developed, and then lastly, our harmful belief has been changed, and if our required skill has been developed. So through this, we could evaluate the impact on the people by applying our intervention. So first one, if any behavior changes. Number two, if their level of knowledge about health education or their illnesses or their practices has been improved, and then a desired attitude has been developed. Also, when we say develop attitude, is that it is something that a person changes how he perceive or how he see his health. So there's an undesired attitude has been increased or developed. And last one, there are a shift of behavior. So a negative behavior has been shifted into a positive behavior. So also their belief has been changed. Also, like if they see their health before you conduct your medical interventions as something that is not usually being taken care of, now because of your interventions, you could see that there is changes in their belief, and then the required skill has also been developed. So in that way, we could positively evaluate the impact of your interventions to the people. The third method of evaluation is the outcome evaluation. But before we dwell on outcome evaluation, let us define what is outcome. So when we say outcome, it is usually refers to the long-term changes that may have occurred as a result of health education interventions. So these long-term changes may include decreases in mortality, morbidity, the prevalence of disease, and the incidence of health conditions being studied. So when we say outcome, it is generally the general result, or the long-term changes that you have observed because of your interventions or because of your health messages. So these long-term changes may somehow include yung decrease in mortality or any significant changes in healthcare services. So yung outcome evaluation, when you say outcome evaluation, it involves an assessment of some of these measurable long-term outcomes or effects of your health education activities. So surveys may be conducted after 3 or 5 years, and they may be difficult to conduct. So yung outcome evaluation, its main purpose also is to assess some of these measurable long-term outcomes or effects of your health education activities. So yung ginagawa yung outcome evaluation through survey. So it is conducted 3 or 5 years after you have conducted your interventions to see if there's really a significant changes in the behavior, in the belief, or yung general objectives mo is na-achieve. So that is the outcome evaluation. So this type of evaluation may be conducted by external agencies. This evaluation may be conducted also by external agencies since it is difficult to conduct. So generally yung outcome evaluation, it is there to assess the main result or the main outcome of your health intervention. So makikita sa outcome evaluation if na-achieve ba yung goal mo, yung objective mo, or yung desired mo na changes that you wanted to see as an outcome by conducting your health intervention. So that's how we discussed about yung impact evaluation at saka yung outcome evaluation.
Assalamualaikum warahmatullahi ta'ala wabarakatuh, and good day. My name is Siti Rayana Haji Salim, and today I'm going to continue the discussion of my group mate. So for this part, I'm going to discuss the qualities of good measurement. Okay, so there are 5 qualities of a good measurement. These are the validity, reliability, measurability, practicability, and objectivity. A measure must be valid, reliable, measurable, practicable, and objective. Okay, so now let's start discussing each of these characteristics. Okay, first one is the validity. So when we say validity, it is the extent to which a test measures what is claimed to measure. So it is vital for a test to be valid in order for the results to be accurately applied and interpreted. So remember, validity is not determined by a single statistic but by a body of research that demonstrates the relationship between the test and the behavior it is intended to measure. Okay, so that is what we mean by validity. Next one is the reliability. Okay, reliability is the consistency of your measurement or the degree to which an instrument measures is the same way each time it is used under the same condition with the same subjects. So, when we say reliability, it is reliable. So, in short, it is the repeatability of your measurement. Kung paano same siya. Remember, okay, a measure is considered reliable if a person's score on the same test given twice is similar. So which means kahit ulit-ulitin mo to na similar pa rin yung result. So it is important to remember that reliability is not measured, it is estimated. So a good measurement will produce consistent scores and an instrument's reliability is estimated using a correlation coefficient of one type or another. So that is what we mean by reliability, which means reliable siya. So kahit ulit-ulitin mo yung measure na, same pa rin siya ng result sa una mong kinuhang test. Next one is the measurability. So when we say measurability, it should measure the objective to be achieved. So which means dapat yung measured nga yung objective mo na dapat mo makuha or the objective of your assessment. Dapat na naka-measure doon, measurability. Next one is the practicability. So, it must be easy to administer, score, interpreted, and apply, and low cost. So, when you say practicability na it should be feasible and usable. So when we say feasible, it should be possible or practical. So practicability, it is the quality of your measures being usable in context to the object to be achieved. Okay, that is what we mean by practicability. And then when we say objectivity, the last characteristic, it is the degree to which a test result are obtained the same by scoring different scores without influence of their basis or beliefs on scoring is known objective. So dapat objective siya and not subjective. So when we say objective, like nag-score ka based on the data that you have really gathered, there is no personal biases or any like your opinion or subjective. There should be no biases doon sa measure mo. Okay, so that is all the qualities of a good measurement. So before I end my discussion, let's have a recap, okay? Okay, so there are, as I've said, there are 5 qualities of a good measurement, and these are the validity, reliability, measurability, practicability, and objectivity. Okay, so when we say validity, it is the extent to which a test makes sure what it claims to measure. And then when we say reliability, it is the consistency of your measurement. Kahit ulit-ulitin mo pa yung test, ay same result pa rin. Kahit pa-repeat-repeat, ay same result pa din. Next one is the measurability. So, in this part, it should measure the objective to be achieved. Yung objective mo talaga is na-measure mo talaga siya dapat. And the next one is the practicability. It is the quality of your measurement being usable in context to the objective to be achieved. Dapat ay feasible siya, usable, ganun. And the last one is the objectivity, and it is your measurement being objective and not subjective. Objective, remember when we say objective, it is not biased, it is not your own opinion, beliefs, it is based really on the information that you have gathered to your client. Okay, so that is all, and again, this is Haji Salim Siti Rayana, and I hope that you have learned something from my discussion. That's all, and thank you.
So for the fourth one, interaction process and analysis or process reading. Interaction process analysis is the process of encoding and decoding the study pattern of teaching and learning. This refers to a technique consisting of objective and systematic observations of the event for the study of the teacher's behavior and the process of interaction going inside the classroom or health teaching setting. While process reading is a written account recording of all that transpired during and immediately following the nurse-client health teaching. This is the recording of the conversation during the interaction of the interview between the nurse and client in the health teaching. So the purpose of process recording is to critically analyze communication and its effect and behavior of the individual. This is to gain the client's confidence and get his or her cooperation, as well as establish rapport with the client. It is also to study the patient's psychological, social, and emotional behavior, as well as to help increase the ability to identify the problems and develop skills in solving them. Its goal is to establish a therapeutic nurse-client relationship. This is to give necessary health education to the patient and obtain the identification of the patient, as well as to assess the insights of the given patient. So the process recording is one method by which we can record the content of the health teaching. This is to record the conversations, verbal time. We can use a recording device to obtain the patient's permission for using it, because this will be used in reviewing the health teachings if needed. And each process recording should be concluded with a summary. So in conclusion to this, conducting a process recording or interaction process analysis gives the opportunity to improve and the opportunity to learn and acquire more developed communication skills, self-awareness, assessments, learning to listen properly to the patient, as well as having keen observations. And this is also provides with an additional opportunity to practice nursing values and ethics.
And that concludes our report on assessment and evaluation. I hope you guys have learned from our discussion. Once again, we are the Group 6, and thank you for watching and listening.